After more than a decade of development with leading innovators in healthcare, a cutting-edge, science-based engagement method called CITE has become available technology on the Phrazer Kitsune platform to replace the antiquated patient staff flow process. With CITE, the hallmarks of staff's improved work experience include reduced data entry, more top-of-licensure application, improved patient interactions, and proven support of your natural proclivity to provide the most effective and equitable care possible. CITE stands for Communication and Information Theory Empowered. CITE solutions work because they are designed with the most up-to-date sciences of human behavior, psychology, brain research, social sciences, and accurate information exchange at the core. CITE is only available on Phrazer Kitsune, the world's only medical-grade engagement platform. Together, they unlock never-before-possible advancements in healthcare. CITE solutions dynamically adapt to each patient, so that no matter who they are, where they're from, what language they speak, their culture, age, or level of literacy, they're all engaged equally and effectively. The patient-staff relationship is enhanced and strengthened. Patient rapport is established through use of visual, tactile, and emotional CITE techniques that build comfort and trust. That's why 96% of all patients prefer CITE solutions to conventional methods. CITE brings you back to the bedside, so you spend less time charting and more time with your patients while performing at top of licensure. CITE breaks the conventional one-to-one limit and empowers you to effectively engage with multiple patients at the same time. With asynchronous CITE engagements, patients actively progress their care, knowing they're always in contact with their care team. By simply interacting with Phrazer Kitsune, patients author their own chart and take an active role in their care. They're informed, supported, and involved throughout their journey, while staff receive relevant, real-time updates, process adherence guidance, and cultural cues through audio and visual indicators combined with qualified decision aids. CITE significantly reduces error rates, and medical errors due to communication barriers are nearly eliminated. Patients converse effortlessly with staff and receive information in a manner they can easily understand. As a result, compliance and completion rates are higher than ever before. By adapting to a patient's specific background, their healthcare journey becomes more effective and more efficient. That means a harmonized, more predictable patient flow, greatly improved speed to treat, and the best application and augmentation of staff. With CITE, you're positioned for success and armed with actionable information for a meaningful patient encounter. Unit performance increases, and the outcomes are better for everyone. CITE solutions not only bring total equity and boost efficiency, but also provide an unmatched return on investment and real cost benefits. With CITE, downcoding issues are vastly reduced, costly point solutions are consolidated, and new revenue pathways are opened. CITE solutions are designed to fit any use case, and their versatility makes rapid innovation easy. Not only will CITE solutions fulfill your needs today, they grow with you to meet the changing needs of tomorrow. We are your collaborative innovation partner, creating the future of healthcare to benefit you, your patients, and system. Join us in the new CITE 2020 era and unlock the true power of CITE solutions. Modern, equitable, and effective medical engagement.